the pandemic has highlighted a disparity in health care in the United States, and we're talking more and more about it now with two doctors on the front lines of the pandemic and the inequality of American health care. Bertha Coombs is here to lead the conversation. Bertha.
Thanks very much, Tyler. You know, some African-American doctors writing in the New England Journal of Medicine this week framed the twin crises of the COVID pandemic and the social unrest in the wake of George Floyd's killing at the hands of police in the terms of stolen breaths. They argue that the epidemic of police violence because of implicit bias has become a public health threat for people of color. And of course, the impact of the COVID-19 crisis disproportionately affecting people of color underscores the fact that in healthcare, this has also become a problem in terms of poor health outcomes. Joining me now are Dr. Patrice Harris, who is the immediate past president of the American Medical Association, and Dr. Oliver Brooks, who heads the National Medical Association, which is the nation's largest organization of Black doctors. I want to start with you, with Dr. Harris. You and your recently completed tenure had really focused on the issue of health equity. You helped the AMA launch a Center for Health Equity to focus on these issues. It must feel just incredible to see this become something that is now very much on the front burner.
Well, I am so glad that we are having more intense, more focused conversation around health inequities. Of course, pre-COVID-19, these issues existed, but COVID-19 has brought into stark relief issues around health inequities, racism, and of course, these recent episodes of police violence, again, has demonstrated a disproportionate impact on Black and brown people in our community. And all of these are a triple threat to the health of the public, to public health, COVID-19, racism, and police brutality. So I am glad that we are having the conversations, but what is more important will be the action. And as you said, the AMA established our Center for Health Equity a couple of years ago, and we have hired our first Chief Health Equity Officer. We have a new partnership with Essence and the NMA. Glad to be on with Dr. Brooks. And so we are identifying those issues. And it's important that individuals and organizations look at structural discrimination, structural racism, as well as individual implicit and unconscious biases. It really is going to take an all-in effort to address these issues, and not just the health community, by the way.
Let's bring in Dr. Brooks. You testified this week in the House Energy and Commerce Committee about some of the ways to address this. And one of the main issues you talked about is implicit bias training, anti-bias training for clinicians and other healthcare workers. Why is this so important?
It's important because implicit bias is subconscious. So a lot of times people don't even know that they're doing it. So to reverse the effects of implicit bias, which we see both very directly in police brutality, but also in healthcare, is to have the implicit bias training. There was a study done in 2017 by just using mindfulness. Trainees, those that were in the training, focused more on the moment and what was going on. It did not trigger their internal biases. There was another study done in 2017 that showed the same thing. So if we are going to achieve equity as it relates to race and racism, then we clearly need to have implicit bias training.
So there's tremendous research, some on, for example, the fact that non-Black doctors tend to underestimate pain in African Americans because they sort of have this unconscious belief that African Americans are more tolerant of pain. One of the other things you talk about is more training to bring more Black doctors online. One of the issues that seems to be an impediment for many is the fact that the training is so expensive. A lot of people have to go into so much debt.
So Interesting. First of all, part of the HEROES bill that passed the House on May 15th has student loan forgiveness. But we do need more black doctors. There was also a study in Oakland that showed that when African-American men had treatment by African-American doctors, their outcomes were 18% better. So you see worse outcomes as it relates to times when white doctors treat black patients. And you also see better outcomes when you have black doctors treat black patients. And of interest with the implicit bias, there was a study that showed that black doctors tend to have inherently less implicit bias as it relates to race.
Dr. Harris, when we talk about steps that need to be taken, obviously the health community needs to do it, but do we also need to have political backing for these kinds of measures? Dr. Brooks asked Congress to fund more diversity in terms of research for medications, for example.
Absolutely. We need to tackle this issue on so many fronts. We do need more research. We need more people of color to enter into clinical trials. Now, we know that we have to earn the trust of many in the Black and brown community because of the past legacy, but we need that as well. We do need to enhance our pipeline. Student debt is a huge issue, as you heard from Dr. Brooks, but we need to start even earlier. And I know there are many pipeline programs. I know the Morehouse School of Medicine here in Atlanta is really involved and engaged. Many. We are at the AMA, NMA. We are all engaged in looking at pipeline programs. Training is so very important, as Dr. Brooks said, but we also need policies and procedures. Everyone, institutions need to look at their own policies and procedures. They need to look at their boardrooms. They need to look at their leadership to make sure that they have Black and brown people who are in powerful positions, in decision-making positions. And we also need to change the culture. Now, that may take a while, but it's culture, it's training, and it is policies and procedures. We need work in all three areas.
And Dr. Brooks, I'll give you the last word in the time we have left. Do you feel hopeful? I've seen doctors out joining with protesters, demanding for greater social equity. Do you feel as though something is in the air and is really going to change?
Yes, there is something in the air, and things are already changing. Here in Los Angeles, there is discussion at the city council about redirecting some of the police funding to social services. Also, I have friends that are in the corporate America, and the conversations they are having with their white counterparts is different. It's palpably different. This is a pregnant moment. And you do note also that the police brutality went worldwide. So it was happening in the UK and other countries. So something has happened. There has been a nexus. I look at the social underlying pandemic of police brutality, and you have layered upon that an acute biologic pandemic of COVID-19. And I believe it's just the combination of the two that has just brought people to a particular place. There's a clear spotlight now on racial and ethnic inequities, and we must act now, because after all is said and done, more is said than done. So we must do something now.